Addiction to alcohol and other drugs is a brain disease. The illness can be fatal, but is also treatable. According to the Journal of the American Medical Association, roughly 50% of individuals with severe mental disorders are affected by substance abuse. 37% of alcohol abusers and 53% of drug abusers also have at least one serious mental illness. And of all people diagnosed as mentally ill, 29% abuse either alcohol or drugs. These statistics complicate treatment.
Dual diagnosis essentially means that there are two different illnesses occurring at the same time. So medically it could be somebody who has hypertension and diabetes. In the behavioral health world, it's someone who has a mental illness and a substance use disorder. So for instance, somebody who has depression and alcoholism. Treatment is complicated because you have two different illnesses occurring at the same time.
Finding help for the dually diagnosed individual can be problematic because many treatment facilities are only able to treat the addiction or the mental illness, but not both.
The challenge in finding a treatment facility for dually diagnosed individuals is that mostly because of funding sources, many facilities are treating either addiction or psychiatric illness. And because of this, a large percentage of folks with dual diagnosis end up going back and forth to different treatment facilities and not getting the effective treatment that they need.
Treatment providers like Westbridge Community Services that offer integrated dual diagnosis treatment help their participants into recovery by simultaneously providing mental illness and substance use services in one setting.
Westbridge is unique in that we involve our participants and their family members in everything we do. From the design of our facilities to how we run our programs and even our hiring process. The perspective of families and individuals is really vital to everything that we do.
Westbridge Community Services is a private nonprofit organization dedicated to providing evidence-based treatment to individuals and their families that experience co-occurring mental illness and substance use disorders. Westbridge provides a fully integrated continuum of care, including residential services, intensive community case management, assertive community treatment, and family education and support.
I had a much different experience at Westbridge with treatment because when I arrived I had drug addiction, and what they did was they met me where I was at, and they were able to come up with a plan involving my family that would help me so that instead of getting sober and relapsing, I could be successful in the community.
Westbridge was started by a family in Philadelphia that has a family member who has a co-occurring major mental illness and substance use disorder. And while they had all the financial resources that they needed to access really good care, there really is not a lot of good care for people that have co-occurring mental illness and substance use disorders. So Westbridge was started to help families like themselves so that their individuals and families can come here and learn the skills they need to recover, and essentially we're a place where people come to heal.
It is so important that families receive support regarding issues and questions that may come up about health insurance, medication, living arrangements. And that's where Westbridge has been there for us. And we can trust that when we have a question, we can call them, we can email them, and they will get back to us in a timely manner with our family members' best interests at heart.
Since 1987, the Dartmouth Center for Evidence-Based Practices has studied dual diagnosis and has helped providers establish programs based on evidence gained from research that has shown to improve the lives of adults with severe mental illness and substance use disorders. In addition to consensus-based and other tried and true evidence-based treatment methodologies, the Westbridge staff believes that these practices should be available to all persons with co-occurring mental illness and substance use disorders.
The evidence-based care for people who have both mental health and addiction problems is what's called integrated treatment. And what that means is that the same team or system of care combines the mental health and the substance abuse treatment into one setting, one team, and hopefully one clinician. And that's really important because clients who have both problems are not really able to go back and forth between two treatment systems and make sense of the different messages. The burden of integrating these things ought to be completely on the clinicians and the clinical care system. So integrated treatment is much, much more effective, and there are now over 50 what are called randomized controlled trials to show that integrated treatment works, but it's not used in most parts of the country.
Westbridge offers a wide variety of services in its 3 locations. Services are designed to match the level of motivation that each individual expresses for working on their goals.
We are located in Manchester, New Hampshire, Medford, Massachusetts, and Brooksville, Florida. In Manchester, New Hampshire, we have a 20-bed men's residence and an assertive community treatment, community case management team that's co-ed. Medford, Massachusetts, we have an assertive community treatment team that is co-ed. And in Brooksville, Florida, we have a 20-bed men's residence and a co-ed community case management team.
Treatment doesn't stop after residential care ends. Westbridge continues to provide intensive community support, monitoring, and case management based on each individual's needs, and these services adapt to changes in a participant's symptoms and recovery.
Relationships are really the cornerstone of treatment, and while it's important to do what works, which are evidence-based practices, it's really the relationship that happens between the individual and the counselor, or the family and the counselor. That's really where all the good work happens. That's where the magic is. And without that relationship, people don't have good outcomes. People don't get better.
If you or a loved one has been diagnosed with a co-occurring mental illness as well as substance use, treatment is available so that you can live a life of recovery. Family-centered treatment for co-occurring mental illness and substance use disorders. To find out more about Westbridge and the services available, call today or visit westbridge.org.